So welcome guys to this video, because in my last video I talked about the reversible indirect cholinergic agonist. So in this video I'll be talking about the irreversible classification under the indirect cholinergic agonist. So specifically this will be talking about organophosphate. The organophosphate part covers all this group, because naturally organophosphate, they irreversibly inhibit what acetylcholinesterase, which means when they inhibit acetylcholinesterase, they do not stop. They can continue for what, weeks, days, for a long time, and this will even produce much more cholinergic what crisis rather than a normality. So if you are using it to even treat a patient, what happens, you can even now produce more symptoms than the helping you are helping. So you are trying to help the patient, so much more you'll be seeing more side effect than what you are trying to treat. So that's why in clinical practice they don't usually use it, and even though they use it, it must be controlled. It must be controlled. So under this classification, under organophosphate, we'll be starting with what, echothiophosphate. So echothiophosphate is an important organophosphate. This important organophosphate is that when you give patient the drug, it is used basically in ophthalmology to tackle what, eye condition, especially glaucoma. So when you give patient echothiophosphate, they want to what, produce what, meiosis. They want to also produce meiosis, and they want to reduce what, intraocular pressure. So it's used to tackle what, glaucoma, for a long time, but it's rarely in use. Why? Because it is producing more side effect than it is even helping the what, patients. So that's why they don't use what, echothiophosphate, because it's an organophosphate. It will inhibit what, acetylcholinesterase for a long time, which means its duration of action is like a week. So a single dose given to a patient can produce what, relief for a long time. So when you give it to a patient, it can produce relief for like a week, and it's very good though, but the side effects are more than the effect of reducing what, intraocular pressure and increasing what, aqueous humor drainage. That effect we want to get, which is good for us, but the side effect is more, because the side effect is more systemic, because patient can present with blurry vision. So when you use the organophosphate for a long time continuously, the patient can now present with cataract. One thing. Also, major systemic side effects can include what, bradycardia, hypertension. So patient can come with all this stuff, and it is not good. So in diet, so they don't give it to patient again, because they are also neurosynthesized. So you can give patient pilocarpine. You can also give patient carbachol, but carbachol is also not in use. So with time, I'll also give you other drugs you can use to tackle what, glaucoma. So it is very, very simple. So they don't give to patient like that. So it is used as a topical agent the same way pilocarpine is used. The same way pilocarpine is used, so it's also used as eye drop, so that its effect will be what, faster. You get it now. So it has a long half-life, so its degradation takes longer. So that's why we don't even use it, because the side effect. So don't give it to patient with asthma, don't give it to patient with COPD, don't give it to patient with uveitis, don't give it to patient with cataract. Don't give it to patient with cardiac conduction issue. Asthma, COPD, uveitis, cataract, and cardiac conduction what issue. Another organophosphate we'll be talking about is nerve gases and insecticide. So you know your Baygon, you know your Paration, you know your Malathion, you know your Serine, you know there are various insecticide and also pesticide agents to patients that is exposed to pesticide and insecticide. They can also have organophosphate poisoning too. And when patient is exposed to all these insecticide and pesticide, it is very toxic, because this one, it can inhibit what, acetylcholinesterase for a long time, which means it can stay for weeks. Sometimes can stay for a long time, up to a month. This CNS toxicity that will be produced will damage the patient very well, because the patient's heart rate will go down, the blood pressure will go down, so the patient might even die. So patients usually absorb it in the skin. Why? Because their lipid was soluble, so it can be absorbed by the skin, by the lungs, by the GIT tract, so it can stay for a long time. Now the side effect I've given you, so I've given you was sludge BBB. So this one, you can also use dumbbells. So dumbbell is also, when you have organophosphate poisoning, you'll be producing a symptom called dumbbells. But the mnemonic I give you, sludge BBB, is an the sludge BBB I give you is a symptom under what, indirect cholinergic agonist, sludge BBB. But these dumbbells are what, cholinergic or toxicity you get from what, organophosphates. So what are the side effects? The first one is D, dumbbells. D, what is D? Diarrhea. So when patient absorb this organophosphate, the first one is that there'll be increase in what, contraction of the GIT tract. Due to the organophosphate, we inhibit what acetylcholesterol, which means enough acetylcholine will bind into the M3 receptor, increasing what motility and what secretion. Well, when you are increasing motility, the food will have less contact time with the what small intestine, which means there's no absorption. So all the food will be what getting out by what defecation. So there'll be diarrhea. So two, there'll be urination because of the M3 receptor too. So when acetylcholine is binding to the M3 receptor, what happens? There will be constriction of the detrusor muscle. So when there's constriction of the detrusor muscle, there will be what urination. There will be meiosis also because when you bind to the M3 receptor also in the soleus muscle and the sphincter papillae, there will be what enough of what accommodation and what meiosis. Also, dumbbell DUMB. What is B? Your bronchospasm. So what is bronchospasm? Bronchospasm, when they bind to the M3 receptor, what happens? The bronchus will be constricting. So if the bronchus is constricting, the patient will have issues with taking in air. Don't forget. The next one is bradycardia. Remember, acetylcholine will bind to the M2 receptor. When you bind to the M2 receptor, the heart rate will reduce. So the next one is E. What is E? Emesis. So the patient will be vomiting. Why? Because most diarrhea condition present with GI cramps, abdominal disturbance, and also emesis, which is the patient should be having nausea and what? Vomiting. Don't forget. Also, there will be lacrimation due to the binding to the M3 receptor too. Acetylcholine bind to the M3 receptor in the salivary gland. We produce what? Salivation, and bind to the M3 receptor in the tear gland, producing what? Lacrimation. So there will be salivation, there will be sweating also. All this, so don't forget the mnemonic dumbbells. Dumbbell, DUMBBELLS. So dumbbells is a mnemonic to get the cholinergic toxicity, the side effect gotten from cholinergic toxicity. While slot BBB is a mnemonic used to get the side effect for indirect what cholinergic toxicity. So don't forget. So what is the antidote used to counter organophosphates, which is nerve gases and what insecticide and also pesticide? So you are using atropine. Atropine is used to counter the muscarinic effect. So when you give atropine, what atropine will do? Atropine is an anti-muscarinic agent used to counter what? The effect on the muscarinic what? Receptor. So you also give the patient Pralidoxime. So Pralidoxime will do what? Counter their what? Irreversible effect on the what? And you are giving what? Atropine to block the what? Muscarinic effect, and you are giving Pralidoxime. Pralidoxime is used to counter the irreversible effect of acetylcholesterase. So I hope it all made sense to you and you understand the what irreversible what indirect cholinergic agonist, where we talk about the organophosphate. So organophosphate can be given as a drug called Echothiophate as a topical agent, or when you are exposed to insecticide, pesticide, or nerve gases used in water warfare. So under the insecticide, you can use Bagon, can be used Bagon, which is fleet you use to what kill what insect, or under the malathion, you can use under hair lice, your hair lice. So when some people will want to kill the hair lice in their hair and now add some of this malathion in their hair. So if you use some medicine used to kill lice, put it in the hair, it can diffuse through the skin and cause all these cholinergic or side effects. Nerve gases can be used in warfare, so they use it to fight wars. So in war combat, they use nerve gases. So when the enemy perceived or when the enemy take it by inhaling it, what happens? You produce all this cholinergic effect. So make sure to subscribe to my video and continue liking it, continue promoting it, and send it to all medical students, because I am developing the video in order to help all medical students in order to understand all medical topics, especially pharmacology, pathology, anatomy, physiology, biochemistry. So other courses, we also have YouTube for physiotherapy cases, YouTube for calculations, which is mathematics, physics, chemistry, and co. So I'll be dropping all the links so that you'll be following it and also follow my video. So I'll also see you in the next video. Bye bye.